So now we're going to get started. Thank you all for your incredible patience. We normally do start on time, but this is kind of a big deal. So thank you all. Welcome. My name is Judy Mark. I am the president of Disability Voices United, which is an organization founded, directed by and for people with disabilities and family members. I myself am a person with a disability, as well as have a son who is turning 24 on Saturday, who has autism. And so happy birthday, Josh. We are overwhelmed at the amount of interest in this particular meeting today. This is a town hall. And so we need to, we have a very specific topic we're talking about. I know that I've seen a lot of emails come in advance asking very technical questions about safety of the vaccine, asking questions about how they get access to the vaccine in their particular community. That's not going to be the topic today. We will try to get to some of those issues in the future. But today our topic is the fact that we as a community, as a disability community, need to unite together and work hard to get to inform and to urge the governor and the Secretary of Health and Human Services to prioritize our community and to make sure that people with disabilities are on that list to be able to get earlier access to vaccines. And we have a really illustrious, amazing group of people who are joining us today, who have actually been on the front lines on this issue from the beginning, and have done some really incredible advocacy and have some advice for us as a community. But as we do in all of our, in everything that we do at Disability Voices United, we start with the people who are with disabilities first and family members. And so the first person that I would like to present is Tim Jin. Tim is a board member of Disability Voices United and one of our founders, but he is also an incredible advocate and sits on a great many boards of directors. And he is a person who is served by a regional center and a lot of staff, and has a very important advocacy, some advocacy words for us. So go ahead, Tim.
Hi, my name is Tim. I live on my own in my house with staff coming and going throughout the day. There is no physical distancing with any of my staff because I cannot do anything on my own, such as eating and going to the bathroom. For the past 10 months, all of my staff have been extremely careful to not get sick, having limited contact when they are off the clock, washing their hands, social distancing, and just being very aware of where they go. I have about 6 people helping me throughout the week, and they are never in physical contact with each other when they are coming and going in my house. When they help me, it is always one-on-one. I only had a handful of friends come over in the past year, and it has always been outside. We have been extremely careful, and so far it has been working for us. There have been a few hiccups here and there. A few weeks ago, I had a scare with one of my staff that helps me during the weekday. This staff helps me about 40 hours a week. Over the weekend, it got exposed by someone who tested positive, but he didn't know it until after he came to work on Monday. He found out that the other person tested positive after he finished his shift. Thankfully, he didn't have any symptoms and tested negative, but he had to take 10 days off. I was in panic mode for a few days, but I didn't feel sick or have any symptoms. I was more afraid that I got my other staff exposed because of the shift change between staff. Once the agency found out what happened, they took appropriate action to quarantine me and my staff. Luckily, we dodged another bullet. But when the vaccine was approved, I thought, this is what will save us. I was sure, based on the news reports, that people with disabilities would be toward the front of the line to receive the vaccine. But Governor Newsom has overlooked us in his vaccine plan. His plan gives priority to people based on their job and age, but so far has neglected to account for the needs of Californians with disabilities. Why would a healthy 50-something get the vaccine before me, a 45-year-old man with significant disabilities? That's not only heartless, it's bad policy and doesn't follow the science. Studies show that people with disabilities who contract the virus are far more likely to die from it than the general population. One study found that people with Down syndrome are nearly 5 times more likely to be hospitalized for COVID-19 and face 10 times the risk for COVID-19 related death. Many other states have stepped up to give people with disabilities priority in their vaccine distribution plans. Ohio is already vaccinating people with developmental or intellectual disabilities and certain medical conditions. Vermont plans to give priority to those with Down syndrome. Tennessee and Indiana put people with developmental and intellectual disabilities high on their lists. And Oregon even designated one vaccination center in Portland specifically for people with disabilities and their families. Where's California's plan for people with disabilities? It's desperately needed. Not only do many people with disabilities have comorbidities that make them vulnerable if they get the virus, but many have routine contact with multiple caregivers and support people, increasing their risk of being exposed. And many people with disabilities are non-speaking and may not be able to communicate when they aren't feeling well. Others have sensory challenges that make it difficult or impossible for them to wear protective masks. It's a little ironic that the state has approved vaccines for caregivers who support people with disabilities, but have left out the people who need it the most. In theory, this is to protect the vulnerable. But you know what will really help more? Actually giving us the vaccine. I am more at risk because I rely on my staff to help me in my house. I come in contact with multiple people every day because of my cerebral palsy. There is no way for me to know what my workers are doing once they clock out. Due to my fears of getting COVID, there are days that I don't even step outside from my front door to get some fresh air. My family has always been opposed to the idea of putting me in a group home, because they always raised me to be independent as much as possible. Since last March, I feel like I've been living in an isolated institution. Now that we have a vaccine for the virus, millions of people in our disabled community are once again being hidden away and not being seen or heard. It's time for California to recognize that and make us a priority. We can't wait any longer for the vaccine.
Thank you, Tim. That was incredible. Thank you for starting us off on that extremely important message. I'm now going to turn to a family member because so many family members really understand what it means to advocate for those or for our family members who are really most at risk. And I now like to introduce Elizabeth Espinosa. Elizabeth is the amazing sister to Christian. And she also is on the board of Westside Regional Center and is very involved in the disability movement, disability rights movement. So thank you for joining us, Elizabeth.
So much. Thank you for all that you do and everybody on this call. Families, you're not alone, but let me just say this, Tim, you are amazing. And thank you for saying that. I wish that my brother could be that voice that you are, but isn't that life strange? My brother can walk, right? He can walk outside, but cognitively. So Christian, my brother, let me show you really quick here. I'm not as fancy with a slide or anything, but he's on my screen. And so this is Christian. He is 36 years old, and he suffered lack of oxygen at birth. So Christian is 37, I lied. 37, he's 6'1", 6'2", he's very tall, 300 and about 15 pounds, has a lot of comorbidities. So that's the fancy word for saying that he has high blood pressure, neuropathy, he has diabetes, he's on every medication, insulin, orals, everything. I mean, he has so many health issues that, Tim, I feel you, and you're right. It's so scary. I don't even like to, see, although I have to, because you don't want other people to come to the house. This is such a difficult time. And Tim, I feel your frustration and all the families that are on board here, because I get it. The vaccine movement, some people are afraid, they don't see it, they're anti-vaxxers. I get it. I'm a former TV reporter, so I've heard the stories of anti-vaxxers, but it's a personal decision. And if we should at least give our most vulnerable the first opportunity to get this. And the fact that the conversation that we're having blows my mind. This is obvious, common sense. We should have followed the science. Our people with disabilities should have been first on the list. I think it's great that we're including people over 65. But that should have been with people with disabilities. And let's think of disabilities, right? Because we come in all shapes, sizes, and colors. My brother, for example, okay, during this pandemic, it has been horrifying. He's just like you, Tim. He's isolated. The guy doesn't see the light of day as much, right? One of my challenges was, for example, trying to get blood work, because even COVID testing to this day is a challenge for people with disabilities, right? You want them to go to places where there's super spreader events in some instances. And so then you're risking them and you're risking yourself as a caregiver, protecting them. So I asked for, the nasal thing is difficult. My brother has sensory issues. My brother has behavioral issues. And at 300 pounds, no one's going to tell him no and just pick him up and take him into another room. It doesn't work that way, right? And I think the part for me as a family member, yes.
I'm so sorry. Do you mind just slowing down your speech a little bit, because the interpreters are just wanting to keep up with you?
Sorry. Yes.
I know.
I
know. You and I are sisters. We talk too much.
Right. I'm like trying to get my 5 minutes in. Thank you. It's like this. I remind people with cognitive disabilities, right? Intellectual disabilities, however you want to characterize it. Let's say it's not so much physical, but it's your brain. We don't see it. That wheelchair. And that is a major problem, because right now with the vaccine rollout, there's an expectation that everybody, there are people with disabilities, they can still go at some point to their doctor's office, or at some point they can go and be seen at one of these clinics. It doesn't work that way. There's no way that I would be able to do that with my brother, who is one of so many consumers in California who are in the same boat. So you would never in a million years tell somebody who's a quadriplegic, sorry, there's no elevator here. You're going to have to figure it out. You got to heal yourself instantaneously so you can go up the stairs. No, we have to accommodate all people with disabilities. We have to think about their quality of life. You just heard from Tim directly. I wish my brother could tell me this, but I know that he's telling me this, that he would like to have a sense of security, though he may not understand what COVID is, but we do, and we're trying to protect him. But to be able to go back outside and just to be able to walk into a CVS when there's nobody around and feel like he's not going to catch this thing. He does, he's got the vaccine in him. And again, it's a personal decision. I understand some of you feel like there's not enough data, and that's fair, but that's a decision as families we make. But at least let us have that option. We have to think about all persons with disabilities. And I would budget, for example, for California, and DDS gets something in the ballpark of $10 billion. How is it this conversation wasn't had last summer? Not here to be, attacking anyone, but it's to say, this is an emergency. We can't just have these little fluffy talk. Well, what are we going to do? No, because every day, while those of us who are able-bodied do get to go out and cover up with masks, Christian doesn't tolerate a mask. Tolerate. I didn't say he doesn't want to wear a mask, because you have those people out, right? No, he can't tolerate a mask. So his quality of life was already small. This is pre-pandemic. After the pandemic, it's here. How is any of this person-centered? So I'm so, I speak for so many families that come to me. I have a dear friend, Christina, whose son, we believe, caught COVID, and he was on a ventilator in 0 to 60 seconds. It was so bad. And then you have the challenge of being able to be with your loved one in a hospital setting right now with COVID. And you know that there are a lot of hospitals are saying you can't be in there. Our situation is incredibly complex. It's not a 1-to-1 for my brother. It's a 5-to-1, because he needs to have several different people. He had actually gotten very sick the December prior, and he developed hyperkalemia. So it's this situation where you feel really tired, and you wouldn't, unless you're you're someone who's verbal, you would say, it's weird, I feel extra tired lately. Well, that would be a telltale sign. You would tell your doctor, and they say, hey, let's draw some bloods, some lab, and then your potassium is up, and they do something about it. Well, we luckily had a dental emergency. We were able to get his blood work done, and the potassium was so high they had to admit him. And that was a nightmare, because he doesn't understand. You're not going to put a nasal cannula underneath, the little tube. Sorry, lighting issues. You're not going to put a face mask on him because it's sensory. He won't let you do that. So my brother has like zero chance, like not even the existing medicine we have would even help, because he's going to fight it, even though he would be dying. So I just think that I would hope that, to Tim's point, we have to act with urgency. You can decide as a family, we're not going to do this for my child, my brother, my sister, whoever, but we have to include our persons with disabilities. And it is very irresponsible not to work with urgency to say, let's get this happen. So, thank you, Judy. As you know, I really do a lot of raising awareness as best I can about our my brother, and because everybody is different. And I think we need to think about everybody's, quirkiness, and however it is that we, our challenges in different ways, because some people are easy, they go to the doctors, other, folks can't. Please, I'm on Instagram at Elizabeth Espinosa and OSA, and then Christian is at My Gray Pants. And what we are trying to do is really show the world that, don't be so judgy. Like, my brother doesn't wear a mask, not because he's an anti-masker, but because he can't tolerate a mask. My brother, God forbid, caught COVID, it would be a death sentence. And it's not fair that we're going to sit here and say, well, let's just wait another 6 months, because you're not the one in pain, because you're not the one that doesn't have that quality of life. I mean, it's not fair. And I think we can do so much better. And I to your point, Judy, this town hall is important, because we all have to come together. And it's always frustrating for me, because, look, I'm a TV reporter who has seen and covered all these protests and different rallies. And it's like the people who make the loudest noise, that's who gets the attention. Well, it's not fair that, because my brother can't say, hey guys, I'm over here. And so many Christians in the country, in the world, that we would dismiss, and not maybe intentionally, but just be like, oh, well, we'll get there at some point. No. So I would just call on all of us collectively to raise awareness and really tap into our local leaders and say, you cannot forget us. You cannot forget us. I mean, right now, I can say this. I know there is a lot of, on my end, I'm trying to push even the sheriff's department here in Los Angeles County to try to include people with disabilities. And if, they have a chance to deputize them to administer the vaccine. And last thought is this, there's a way, it would be great if we could make this in a situation where the vaccine could be administered at people's driveway. It should be a drive-through setup. It should be 24 hours. Maybe your child or yours, is better off getting a vaccine at 1 a.m. Israel, by the way, does 24-hour vaccine, setups. I think we've got to think outside the box. Let's be person-centered. Thank you so much. And
thank you, Elizabeth. Thank you. Thank you. All right, we're going to, there's a lot of activity in the chat of people like, well, what do we do? What do we do? Well, we're getting to that. We always start with laying out the problem, and now we're getting to that. And so we're now going to move on to Aaron Carruthers. Aaron is the Executive Director of the California State Council on Developmental Disabilities. He's also a member of the California Vaccine Advisory Committee, and you're going to hear from several folks in that area. So Aaron, why don't you tell us what's been going on and what the governor has decided?
Thank you so much, Judy. And I want to start off by just thanking every person who is here today. It's a phenomenal turnout. Judy puts out the call, everybody responds because it's going to be quality information that you can use. But I also know that there's a lot going on in everybody's life today. There's a lot going on. And whatever you had to do to make this moment work, I really want to acknowledge and honor that. So thank you for being here. I am Aaron Carruthers. I'm the Executive Director of the State Council on Developmental Disabilities. I'm also a member of the Community Vaccine Advisory Committee. And when Judy, who is the fastest speaker I know, tells me to slow down, I know I need to slow down. But there's a lot to cover in just 10 minutes, so I'll do my best to get through it. So overview of what I want to cover is where are we now in vaccines? Also, what is the Vaccine Advisory Committee that we're on? And you'll hear from a number of the members today. And what is the order for the vaccine rollout? So where are we now? Here's a good snapshot of where the state infection rates are tracked over time from March 1st, 2020 through January 24th, 2021. That big bump that we thought we saw in July, where it was dwarfed by the bump that we saw over the winter. What public health has really pointed out when they've shared this chart is how the current trend is tapering off after the winter peak. We'll see if that continues, but that's the current trend. As of January 25th, so that's Monday, California had administered 41 million tests. From those tests, there were 3,153,000 positive cases of COVID in California and 37,527 deaths. For vaccines, there were 3,319,000 doses shipped to California. That's as of Monday. California has been receiving about 300 to 500,000 doses per week. So that's helpful information to think going forward, how many people need to receive the vaccine and how many doses are we getting? Of course, every person needs 2 vaccines. So the number of people needs the double number of doses. The doses administered as of Monday was 2,587,000. The California rate is about 125,000 doses per day. That's about 3 times about where we were at the beginning of the month. So they really ramped up their ability. And they're close to 500,000 Californians having received that critical second dose. So the state of California's Department of Public Health set up 3 committees around COVID and the vaccine. The first is the Scientific Safety Review Committee. It's made up of independent scientists who are looking at the data that's coming out, making their own independent determinations about it. This is such an esteemed group of scientists that it broadened out to be the Western States Collaborative. So I believe there's more than 100 independent scientists who are looking at the data and making recommendations back to the state about the safety of whatever vaccine comes out. There's the drafting guidelines work group, and they're the group that is putting together the phases, the tiers, what we've all really been focused on when we talk about 1A, 1B. And then there's the Community Vaccine Advisory Committee. So there's 70 members on that representing labor, agriculture, teachers. Thankfully, there's 5 members representing disability advocates. I'm glad they're on here now. I'm very thankful for the partnership with Disability Rights California, the California Federation of Independent Living Councils, with Justice and Aging, and with DREDF. With the State Council on Developmental Disabilities, we've been just a line of advocacy that is unrelenting. The values the state has stated about the activity, and this is cut and pasted from their document, so I want to make sure you see it in their words. Ensuring the vaccine is safe, distributed and administered equitably, at first to those with the highest risk of becoming infected and spreading COVID-19. I think that's helpful in thinking of positioning and advocacy. My focus as a member of this committee so far is that the vaccine has to be a priority for people with intellectual, developmental, and other disabilities. Notice the other disabilities part. I am the executive director of the State Council on Developmental Disabilities, but the State Council's leadership has stated that our advocacy needs to be broader because those who are severely impacted by COVID is broader than just intellectual and developmental disabilities. I've known we've talked about when we do our advocacy about saying people with disabilities need to be included, sometimes the state sort of thinks we're talking about everybody who's covered by ADA or everybody who has an access and functional need. The state estimates that's 20% of California. That's not who we're talking about, it's smaller. But then they go really small and think about who's just on the CDC list, and it's okay, well, it's people with Down syndrome. No, it's broader. So we're trying to get to that space in the middle in the advocacy. Other priorities, the vaccine is a priority for caregivers, whether those caregivers are paid or not, whether they're family or not. That the vaccine has to be safe for people with complex medical conditions, see if it's safe for interaction with other drugs. And the vaccine is voluntary and given based on informed consent. So those have been my priorities and focus so far. I'd like to share this slide because I think it's really important. The main reaction, the main concern that at least the scientists have told us about the vaccine is people having allergic reactions, some with anaphylaxis. So I'd like to put up the ingredients of what are in these vaccines because it's hard to find this information, but you know yourself better than anybody, you know your loved one better than anybody, and you know if one of these ingredients is going to be a problem for them. So the mRNA is the genetic material that is the main piece of the vaccine. Then you've got some lipids and you've got some other chemicals in there to help transport the mRNA. So leaving that up for a second so you can take a look to see if there's something in there that you know that you're allergic to. The Moderna vaccine has fewer ingredients. It's just the NRA, the proprietary blend of lipids, and their buffer containing sucrose and sodium. Lipids, sucrose, sodium. I asked scientists, what does it mean? They said the genetic material is basically just in a solution of fats, sugar, and salt. Kind of a nice way to simplify some of the terms that are in there. It's always important to repeat, we don't know if this prevents transmission. So if a caregiver is vaccinated, we don't know if the caregiver coming into the home can still carry the vaccine into the home. So while it's good to keep up the good practices of face masks, washing hands, keeping 6 feet apart, this piece about not knowing transmission, I think really plays into how do we as a community weigh out the risk? And all of this is weighing risk all the time in every situation. Because there's not enough vaccine, of course, the state's in a process of setting priorities. We're in a scarcity state. So they're trying to craft an equitable, evidence-based framework. Right now, we know that the phase 1A is out there. It's been rolling out. It's healthcare workers, it's long-term care residents, and the state estimates this is about 3 million Californians. An early advocacy success, an early advocacy win that we had on the Community Vaccine Advisory Committee was getting a broader inclusive definition of a healthcare worker. So phase 1A includes these critical words that it's a home health care and in-home supportive services. Notice none of those words are capitalized except for home at the beginning of the sentence. So we're not talking about home health care formal. We're not talking about IHSS formal. We're talking about these as a description of the types of services that are given. So because of that, we're able to see, Department of Social Services was able to give a letter to IHSS saying, okay, everybody covered. But also the Department of Developmental Services was able to release a letter saying, okay, here are the vendors, regional center vendors covered. And really critically, here are the family members who are covered. And it doesn't have to be paid work. If you're a family member who's providing care, some of the developmental disability, that's considered home health care and you're eligible. What happens when you get there at the appointment, that's different. And I do a lot of one-on-one phone calls with people calling me in crisis in the middle of it and just trying to get them through that process. But at least the policy set. For the state, here's where we are. And this is what the governor this week, we've got the 1A, the next set of priorities are these principles. One's to simplify the vaccine eligibility framework. Next is to standardize vaccine information and data. And third is to address supply. By addressing supply, it's about administering what the state has and seeking additional supply. The real overarching value here is that nothing should slow down the administration of the vaccine other than the pace that the state can get them. So let's circle back to that top one, simplifying the vaccine eligibility framework. Here's what it currently means. It means people over 65. It means people in occupational risk. So that's education and childcare, emergency services, food and agricultural workers. It also means vulnerable communities. And the state is looking at equity indexes to try to figure out which communities are vulnerable, going to be impacted by COVID. I think this is an opportunity in the advocacy to show how people with disabilities fit into this definition. Right now, this group of people are eligible to start making appointments pending vaccine availability in their local area. Formally, people with underlying medical conditions and or disabilities that would be adversely impacted by COVID are in 1C. That's along with people over 50 and other unvaccinated essential workers. So the advocacy focus has been that people with intellectual, developmental, and other disabilities and older Californians be included in Tier 1B. We feel this can be really a way that takes an equity approach, that takes an index approach, is to use people receiving home and community-based services as that marker, that marker to say this person's disability is severe enough that it's very likely they would be adversely impacted if they receive COVID. And that's what we've been advocating. The state has had difficulty in figuring out how this would actually fit. They seem to want there's no marker within someone's medical record that says you're receiving HCBS services. So it's square peg, round hole is some of the conversations. But this advocacy letter has been, we wrote it, the 5 disability advocate representatives, recirculated it back around over 270 organizations, over 550 individuals signed on to it. And Judy and the members of Disability Voices United really want to thank you for being a part of that strong advocacy. So with that, I hope that was a whole lot of information in a short amount of time. And I apologize to the transcription and transcribe interpreters who had to keep up with all the information I wanted to cover in this short amount of time. Thank you so much.
Thank you, Aaron. You're extraordinary at keeping to your time. It's happened 100% of the time you do that. Thank you, Aaron. I so appreciate it. I actually need to tell Ed that we're flipping Sylvia with Andy Imperato. You can keep Sylvia spotlighted, but if you could add in Andy Imperato, Andy needs to pop off for a few minutes at 5:30. So I'm gonna introduce Andy next. Andy Imperato is the Executive Director of Disability Rights California, and he also serves on the California Vaccine Advisory Committee and has been a real leader and spokesperson on these issues. So thank you for joining us, Andy.
Well, thank you for having me and for shaking up the order, and thank you, Sylvia, for letting me go first. The thing that I'm stepping off to do is more media on this topic. The LA affiliate of All Things Considered is going to do a live interview with me right after 5:30, so I apologize. You guys have gotten a lot of detail from Tim, from Elizabeth, and from Aaron, so I want to kind of simplify as best I can where we are. I think first, Alice Wong, who's a phenomenal disability activist in San Francisco, started a hashtag 2 nights ago on Twitter called hashtag #HighRiskCA. So the basic idea is anybody in California who's at high risk of getting COVID or having bad consequences of getting COVID should have access to the vaccine, and we cannot afford to wait. What we heard from Dr. Erica Pan at the last meeting of our Community Vaccine Advisory Committee is that it may take them until June to do everybody over 65. Now, our message is not to make people over 65 wait. We think it's good that they are prioritizing older folks who are at more risk of having bad consequences of COVID. Our message is don't make everybody else wait while you're doing the people over 65. We cannot afford to wait until May or June to get the vaccine. There are huge parts of the disability community who are more likely to get COVID because they can't control who comes into their homes, and you heard some of that from Tim. And there are people who are much more likely to die from COVID because of their underlying health condition. Those are the folks that we feel should be prioritized alongside farm workers, alongside teachers, alongside people over 65. We're not trying to supplant those other groups. We want to have access at the same time as the other groups. And we want our governor to do everything in his power to work with the Biden administration to get a lot more vaccines coming into California. They just announced today that they privatized the vaccine distribution through Blue Cross, through a private company. You know, to me, that might be good. Who knows? The private company may do it better than the state has done it. But I remember on one of my early webinars that Judy invited me to come on to when the pandemic started, I said that the response to this pandemic has been a failure of government at every level. Well, the same thing is true with the vaccines. The government at every level, state government, federal government, and local government, they are not recognizing the importance of getting the vaccine to people with disabilities who are at high risk as an early priority in vaccine distribution. They prioritize people in skilled nursing facilities, but not people in the community. So what's the message there? The message is, if you want to save your life, live in a dangerous environment that violates your civil rights. And if you want to have civil rights, you're risking your life. That's the message that we've gotten from the state of California. So what we're hearing from lots of our allies in the state government is the only way that we're going to influence the decision-making around vaccines is by making a lot of noise. So that is what we are trying to do at Disability Rights California. That is what DREDIF is doing. That is what the California Foundation for Independent Living Centers is doing. That's what Disability Voices United is doing. All the groups coming together on this call, we are all trying to raise the volume so that the governor recognizes that he will pay a price politically if he continues to deprioritize people with disabilities, and people will die unnecessarily because of a failure of state leadership. So again, I wanted to be brief. I've really enjoyed working with Aaron, with Sylvia, with Christina, and with Denny Chan from Justice and Aging, who's been right there with us in solidarity as an aging advocate on the Vaccine Advisory Committee. We are lockstep. We're going to keep putting pressure on the Department of Public Health, on the Secretary of Health and Human Services, and the governor to make us a priority, and don't make us wait until May or June or later to get something that could save our lives. And I'll turn it over to Sylvia.
Thank you so much, Andy, and good luck on your interview. Come back if you have time.
Okay.
I'd now like to introduce Sylvia Yee, another member of the California Vaccine Community Advisory Committee. And Sylvia is the senior staff attorney at Disability Rights Education and Defense Fund, or DREDIF, which is just the most incredible national organization that fights for our rights every single day. And so we are so thrilled to have you here, Sylvia. Please take it away.
Thank you, Judy. I appreciate the opportunity to be here and to be in a meeting with real people on the ground who are experiencing all the complexities that I'm seeing in the chat. I think Aaron and Andy have done such a good job of giving lots of information. I think actually I'm going to spend a little time talking about some of the nuances, which is not something you necessarily shout out when you're making noise, right? When you're just advocating, but it's just good for us to know that as well. And I'll start off actually where Andy left off, talking about how we were working together, because you should know what the efforts that we've been making, that we've been trying to make as members of the California Vaccine Advisory Committee, the CVAC. I think we came together pretty early, recognizing that we had a lot of common interests. I know Aaron works with the State Council on developmental disabilities, but he has been completely with us and trying to think more broadly across the disability community and the needs for the disability community. And Denny at Justice and Aging has also been thinking about that, because there's just a simple reality that there's a lot of intersection here. There are lots of people with disabilities who are over 65. We're happy that they get to be vaccinated. There are also people with disabilities over 65 who cannot just leave their home, go to their nearest mega center and get vaccinated. There has to be, at this point right now, consideration of how equitable vaccination will occur. How will it happen on the ground? And in the chat, I see lots of instances where that's not been working so well. It's been a great challenge for the state, obviously. I think what we've been trying to do as a group is to come together and give the state the data that we can, the data on the impact of the COVID-19 on people who are under 65, on people with disabilities and pre-existing conditions. And that has been really challenging. I mean, there is a reason that the CDC's list of comorbidities is both over-inclusive and under-inclusive. As Erin says, it includes people with Down syndrome, but not people with other kinds of developmental disabilities. It includes high weight individuals, it includes smokers, it includes people with diabetes. Right? And one of the reasons we have that is because as COVID has progressed across the globe and across the country, there are some conditions it's going to be very clear, because a lot of people have these conditions, that there's a correlation. These are among the people who are dying. For people who have rare conditions, who are not going to be so prevalent amongst those who are dying or catching COVID, you're not going to get that data. We're constantly being asked to provide the data about who is at risk. But we're not the scientists who can collect and analyze the data. We are stuck with the data that is there. Some of the racial and ethnic groups have been fighting for decades to get some of this data. And finally, some of that is coming out. Some of it is being recognized, that people, that brown people, Black people, indigenous people are systemically not receiving the healthcare they need to get. That has been a long time gathering that information and arguing to gather those statistics. Disability has to keep fighting for that as well. We're not at that level. We haven't achieved it, but it doesn't mean that people with disabilities aren't dying, aren't subject to greater infection rates, greater death rates, and so forth. So it's been hard to answer this, like, hey, come up with the data, show me the study, show me the exact numbers. There are gaps that are traced back to long-standing failures to collect granular disability information. So that has been hard to overcome. As a group, as I said, we've been trying to emphasize intersections of vulnerable characteristics, looking at the link, and we've also really tried hard to talk about the link between medical rationing and the fear of being caught in crisis standards of care, people with disabilities going to the hospital and then being denied potentially life-saving COVID treatment because there's a shortage. And that is linked to vaccination, because if you're an individual who may be subject to crisis standards of care, the fear of going to the hospital, of being denied care, may keep you from getting health care that you need, may be undermining your health in lots of ways. And that in itself means that you're in particular need of vaccination. There are individuals with disabilities who have been putting off needed healthcare or treatment or surgery because they're at such great risk if they catch COVID-19. They could be at a point now of losing functional capacity permanently. Their life can be at risk. They don't know if their cancer is advancing or not. There are lots of reasons that people with disabilities are at specific health risk. So we want that to be recognized as well. This is a group that is at particular risk from COVID and needs to be recognized and given a safety valve. That's what we've called it in our letter, a way to move up the vaccination list. And as Andy and Erin have said, we've really focused a lot on people who receive home and community-based services, and particularly those who receive home and community-based services through Medi-Cal waivers, through IHSS, through the regional centers, because there is an intersection there of of lower income, of the inability to just shelter without people coming in, as Tim so eloquently said at the beginning. People have to come into your home so you can get out of bed, so you can eat a meal, so you can toilet and bathe. So these are just basic facts that we're really trying to get across to the California Department of Public Health, to the CVAC committee, and to the governor as well, because when it comes right down to it, these are not necessarily people who are familiar with how home and community-based services works. They're not necessarily, they don't know the system, and they don't necessarily know even the basic relationship between home and community-based services and health, that this is vital to healthcare. I think one of the things I was asked is, what is the California Department of Public Health been thinking, and who have they been listening to? I have troubles knowing what even my own family members are thinking, so it's hard for me to answer that one. But I do know they've been tightly focused on simplicity, especially as California's rate of vaccination has been not very speedy. But simplicity without regard for equity becomes the efficient distribution of the vaccine to people without disabilities, to people with economic means, people who drive, people with computers, and so forth. That can't be what we mean by simplicity. Simplicity has to go hand in hand with equity. And equity means that we recognize the needs of people with disabilities, many different types of disabilities, for vaccination, for inclusion in vaccination priorities. Thank you.
Mute. There we go. Thank you so much, Sylvia. That was so incredibly thoughtful, and you brought up some points that I had actually not thought about. So thank you so much. We're going to move on to one more brief speaker before we get into taking action. I know that people are like, what do we do? What do we do? But I think it's important for all of us to understand the context in which we are advocating, because you can't just say, dang it, we should make this happen. You have to understand the context in which we are working. And I think that our speakers have done a phenomenal job of setting that context. So our next speaker is Russell Rawlings, who's a statewide organizer for the California Foundation for Independent Living Centers. Thank you for joining us, Russell.
Thank you, Judy, and thank you to everyone that's here. And thank you to all of our speakers. I've been watching the chat, and I've seen no less than probably 30, 40 times folks are asking, what can we do now? And I understand that energy. So I'm not going to spend a lot of time rehashing what's already been said, but as a community organizer, I'm interested in getting people moving. So I'm going to briefly say, we need your energy. We need your stories. We need that experience that you've had during this pandemic, because so many people are not heard from. These small spaces that the government creates, the state government and your local governments creates, do not allow pathways for your voice to be heard. However, we collectively have the ability to make them shine. So I want to invite all of you to join us at CFILC. We have a program called the Disability Organizing Network, and I would be happy to invite you to join us and include you in our discussions. We're looking for folks who are interested in state level advocacy, writing the governor, being present at meetings, getting engaged, but we're also looking for folks to get involved at your local level, where, to be honest, the state will do so many things and make so many recommendations, but at the end of the day, vaccination is happening in your towns, in your cities, your counties, and your community. And we need to hear what that experience is like to make sure that even after we pull off this monumental task of ensuring that people with disabilities are prioritized properly, that it's actually happening. So I need you all to please contact me. I'm going to put a little thing in the chat right now with my email address, and also a recommendation to use the subject COVID-19 organizing, and let me know in the email who you are, what your interests are in organizing. If you would like to write letters, where you live, give me a little bit of detail about yourself so that I can figure out what you're interested in, and we will get in contact with you. I understand that I'm probably going to be flooded with email after I do this, but just know that I will work with the rest of our network to get back to you. So it may take us a little bit to get you onboarded, but we want to hear your voices and we want you in this work with us. So thank you all. And Judy, I'm also happy to help leverage any other additional organizing efforts. So please let me know how I can support.
That was so well done, even though you only took a few minutes, because you all need to understand we're now about to get to the point where we're talking about engaging with our elected officials and our appointed officials to push this forward. And as Russell has said, this is not a one-off. Like, this can't be that you send this letter because you want this vaccine today, or you want your family member to get the vaccine today, and then that's it. I mean, the reason this has happened to us, I'm going to be very honest, the reason this has happened is because we lack political power in the state of California. We lack any kind of influence. And this is our chance to gain that influence and to maintain that influence over time with networks like Russell has set up, and other networks like we are setting up at Disability Voices United. So this is not like a one-off here, folks. We got to make this happen. So how do we make this piece happen? I'm really happy to invite Amy Wesling to really give you some very specific information about who you contact, the email addresses. I also want to promise that everybody who registered for this will get a follow-up email with all this information. And for those speakers who are willing to allow direct contact, like Russell, who's so awesome, willing to get 100 emails, we will send you contact information plus Twitter handles and all those kinds of social media pieces so that you can stay in contact with everybody. So I'd now like to introduce Amy Wesling, the Executive Director of the Association of Regional Centers, to tell you what you can do. Go ahead, Amy.
All right. Thank you so much. And thank you all for being here tonight, and, really appreciate everyone taking the time out of your busy lives to think about how could you help in this arena, not only for yourselves and your loved ones, but for other Californians with disabilities. Really want to just start off by kind of laying the stage, or setting the stage a little bit. And I think Russell did a fantastic job of really breaking it down in terms of there are a couple of battlefronts, if you will, in this. So the one we're spending a lot of time talking about tonight is how to get the state to change the instructions they give to the counties about how to administer vaccines, in what order to put people. But as Russell said, then the energy shifts to the counties and your local areas. If you see that the instructions that the state has given aren't being carried out at your local level. So I'm seeing a ton of things in the chat about my county isn't doing this or that or the other thing. And the strategies for what to do with that kind of challenge are a little bit different, and have more to do with contacting local officials in your area and really pushing on that. But taking a step back, we have a big problem in our current scheme for delivery of vaccines here in California. And I think people have really laid it out very well. We have found a way to say that caregivers are important, and making sure that people who care for those who would have a bad outcome from COVID are important. And that's IHSS providers, it's regional center service providers, it's family caregivers, and all of these groups that fundamentally are providing service to people with disabilities. But the group that is the giant elephant in the room that got left out is the group that they are all providing service to, the people who could have the worst outcomes from COVID, and that is people with disabilities. You also heard Aaron Carruthers talk about, and some of the other speakers talk about home and community-based services. And I saw a few things in the chat. Well, what is that, and why does that matter, and what's long-term services and supports? So I want to spend just a moment explaining why this is important in the scheme of, what we're trying to do here. Home and community-based services are services that are provided by regional centers, but also by other organizations for seniors and for other people with disabilities as an alternative to living in an institution. So the key is that in California, we have said that people that live in big congregate settings, and I think Tim spoke to this as well, that people that live in congregate settings are getting prioritized. And so part of the message about, hey, what about me or my loved one who has a disability and lives in a setting other than with a lot of other people, one of the points is, and I think that Andy Imperato raised this as well, is that people shouldn't have to live in settings that are institutional or congregate in order to have access to this potentially life-saving vaccine. And that's a big part of the message. The other thing is, I think that there are a lot of people that I'm seeing in the chat also saying, well, what about lobbyists? What's the role of people like me, quite honestly, who spend our lives talking to policymakers? And part of how we see our role right now is helping to engage you all, because it's your stories that are going to be the most impactful. Personally, for me, the stories that Tim and Elizabeth told are far more powerful than anything I could ever tell, right? Because they're from lived, shared experiences. And those stories are really what's going to be important. And Tim and Elizabeth aren't the only ones with those types of stories. So the question that I think you're all waiting for me to answer is where to take your stories, right? How to take your stories and make them part of the discussion around public policy. So there are three big places where you can take this story. And let's see. Okay, so in California government, there are different tiers of people who help make decisions in this area. So we all know Governor Gavin Newsom, and here in the slide in front of you is both his phone number as well as a link that will take you to a comment form that enables you to communicate directly with the governor's office. So when you click that link, you will get a box that pops up that says, that asks for some basic information about your name and what your issue is, and then has a pretty substantial text box where you can tell your story. Part of the way that decisions are made in California at the state level is that there are people in the Capitol whose a big part of their job is counting how many people contacted the governor's office or a particular legislator's office about a specific issue. The details are important, and it's really good if everybody can include some details from their own story, but volume is also very important. So how many people are reaching out is really essential. Underneath the governor, we have the Health and Human Services Secretary, Dr. Mark Ghaly, and I imagine that you've seen him participating in a lot of the governor's press conferences. Health and Human Services is the agency, which is directly under the governor, that helps to address all things health and human services. So the Medi-Cal program is under this agency, California Department of Public Health, the Department of Social Services, which oversees IHSS, the Department of Developmental Services. They are all under the Health and Human Services Secretary. So if you think about it, you start with the governor, and then you also send information to Dr. Ghali, and there's his email address. And that is that will kind of get you in the right neighborhood. And then as we kind of drill down a little bit deeper, these final decisions are really being made by the California Department of Public Health. And so here is the email address also for the director of the Department of Public Health, Dr. Thomas Aragorn. And so really that is the
There's a spelling error, Amy.
It does look like it.
Everybody, his name is Aragon.
Aragon.
The email is correct. We promise we will be sending these slides to everyone. Plus we'll put it in the email so that it is accessible to everyone, but it is Aragon, no R. Sorry, folks. We will correct that when you get it.
And so within government, these are the key people that you want to contact. But you also want to get a hold of, people like your local legislators and anybody else that you know that can help to bring pressure to the issue. The other thing is that you can also reach out to local media. That works really well. You heard Andy Imperato talking about he's got an interview coming up with public radio, and media is really good because one of the things that your legislators in the California legislature, so either in the Assembly or the Senate, one of the things that they make a habit of doing is reading the local papers from their area. And so even, articles in the LA Times are great, or the San Francisco Chronicle, but sometimes articles that tell a story are also important in more local papers, because again, it's about volume. And one of the things to know about kind of advocacy in all of this is that not many people will take the time to reach out to elected officials or members of the administration to talk about an issue. And so there's sort of a multiplier effect. So there's an assumption that for every person they hear from who is in who contacts them about an issue, remember I said they count the number of contacts, there's an assumption that for every person that contacts them, there's 10, 20, 30, 100 people who feel the same way. And so there is this very large multiplier effect where your voice is actually counting for more, because there are lots of people who won't pick up the phone or won't send the email. Let's see. So then what to say? If you're a person with a disability or a family member or a professional, identify yourself. Explain why the vaccine is important for people with disabilities. As lots of speakers have said, we can't wait for it. Again, highlight the risk of getting and dying of COVID. For lots of people with developmental disabilities or for other disabilities, we all talk about social distancing, but for instance, if you wanted to say, I'm concerned that my family member or that I will get it because I can't really socially distance when I require intimate care from caregivers. Those kinds of things are powerful. Again, you want to say that people with disabilities need to be prioritized for vaccines, and that the rollout of the vaccinations must be accessible to people with disabilities. There doesn't have to be a lot of detail. It just needs to get the point across. And you don't want to get into the place where you're trying to perfect that email and you never hit send. It's more important to get some quick thoughts down and get it done, and get it done quickly. And then here is the information in Spanish, the same information. And this is included so that when the slides are emailed out, then it is more broadly accessible. And again, the same information from the prior slides. So again, it isn't important to make it perfect. It's just important to get engaged and get engaged quickly. And professionals are getting engaged, but really hearing from the lived experience from people who are struggling with this and are terrified that someone that they love or that themselves are going to get really sick is going to have a tremendous impact, particularly if lots of people call and deliver that message. Thank you.
That was great. Thank you, Amy. So just get it done. Just get it done. So we're going to take some questions, but I'm going to put a little bit of conditions on the questions, everybody, because we are not healthcare experts. No one who has spoken today is a healthcare expert. We cannot answer questions about efficacy of vaccines, safety of vaccines. I do want to promise that Disability Voices United next week on Thursday on the 4th, we'll be having a webinar with healthcare professionals who actually can answer this, infectious disease specialists who can answer those questions better than all of us. We are advocates. We can answer questions about the way policies are made, but not about the science piece. The second thing is we are not local public health agencies. So what we're not able to do is to say, to answer a question like, I've been calling and calling, I can't get an appointment. Like, we feel your pain. Like, we know, we also have been hearing these same stories. So we are not able to answer any questions related to you as family members or as caregivers being able to get the vaccine. This is also a meeting about people with disabilities getting the vaccine, not about parents or siblings or professionals getting it. This is about the people with disabilities. So I'd like you to focus your questions directly on that issue, okay? So I'm gonna start with Connie Boyer. I will give you the opportunity to unmute and you can go ahead, Connie.
Okay, hi, Judy. I just want to say to everybody, for those of you who have any vaccine hesitancy, I just got my second vaccine 2 days ago as an IHSS worker, and I'm also a public health nurse. No symptoms. In fact, the first one I had more of a sore arm. So just wanted to give everybody heads up. It's not that bad. My question has to do with how we can really affect policy change. The reason I say this is I was on a town hall with Jackie Spear, who held a town hall on the coronavirus and had several healthcare people. And we discussed the issue that groups were being systematically, how can I say, delayed a lot, like ours, disability. And right now, since they've now opened it up to 65 and over, what's happening is another barrier is even the people in the tier 1A who are caregivers now can't get appointments because everybody's being flooded by 65. And I'm not saying 65, they shouldn't get this, but my question is who do we target the best? I found yesterday, I immediately wrote to the county manager because they run the clinics. He responded immediately. I was shocked last night. So I wanted to suggest that as a possible avenue, talking to your local county manager or your county health officers, talking to the CDPH, the California Department of Public Health. I think what you said about simplicity, that they're focusing on that. Yeah, they're trying to make it the easiest possible groups. So if you go on their website, it has hundreds of people with very compelling arguments about why they should receive vaccine priority. My question is what can we get the most bang for the buck here, where we have a limited bandwidth of people? And I know writing to the governor is important, but I just kind of wonder, should we be targeting the the vaccine committee? Who's really in the decision-making power to change the priorities? Because I think it's going to be difficult to get us to move from 1C to 1B. I mean, I'm even seeing other groups come out with like diabetes, type 1 diabetes. They're not allowing that. That's way down in the priority. So who do we really target?
Yeah, so that's a great question. I'm going to have Andy Imparato, who just came back. If you could unmute yourself. Ed, you may have to allow him, since he just came back in. I know that's something that so people did get to hear specifically. We gave them the names of the head of the California Department of Public Health, the head of the Secretary of Health and Human Services, and Governor Newsom. Are those the right people, Andy?
Yeah, so I really want to emphasize the governor, because out of all of those people, the governor is the one that clearly has the power to change this decision. The governor is the one who's elected by the people and accountable to the people. And the governor, I think, is trying to make decisions based on science, and he's listening to scientists, but he's also responding to political pressure. If all he was doing was listening to science, he would not have opened up all the restaurants like he did this week. That was a political decision based on political pressure. We have to apply that kind of political pressure on the governor himself, but we can also use other elected officials to call the governor on our behalf. So I would give it to the governor, but also go to your state elected officials and your federal elected officials and say, tell Governor Newsom that the disability community cannot wait until May or June to get vaccinated.
Thank you. All right, moving on to Alba Martinez. I'm finding you, and then I will help you unmute. Okay, go ahead, Alba.
Okay, thank you so much for this opportunity. And I've heard, that there's so much concern about the vaccine. I'm a parent of someone with multiple disabilities, and I don't agree with, having, well, it's good, to keep it voluntary and to have it there and to get it as soon as possible. But I hear a lot of community members and advocates that say all people with disabilities, not everybody is in agreement with this right now, at least for me and other people, other parents, they're concerned. And, they don't really, they want to wait. There hasn't been any studies on people with disabilities. And also, I don't know if everybody knows, but, the pharmaceutical companies, they are not liable legally if something happens medically to someone that takes the vaccine. And that's under the PrEP Act, Public Readiness and Emergency Preparedness Act. So I just wanted to mention that, because it seems like, I read articles that say people with disabilities. I've heard here that everything is being generalized. Not everybody is wanting the vaccine. There's a lot of parents that want it right now.
Right. Thank you, Alba. That is true. We were very specific that it should be a person's choice, and we are absolutely understanding. And however, at this point, people cannot choose to get the vaccine if they want to. So that is a definite concern of mine, that people can't even get the vaccine if they want it. I wanted to mention just earlier really quickly that the governor in his statement on Monday used this very bizarre analogy where he said, it's like boarding an airplane, where when people, the first class gets called first and they board the plane, and then but you don't have to wait till all the first class goes on before business class and before coach go on. And I was so stunned at that analogy, because what he didn't seem to realize is that, in fact, first class are not the first people who board a plane. It is actually people with disabilities who board the plane first. And so to me, there is just a complete disconnect in Sacramento, in the governor's office, between what is the reality and what is needed. And the other just part of his analogy, I should also say, is that as you see people with disabilities who are boarding the plane first, you don't see people mad about that who are waiting in first class or in coach. People understand that people with disabilities need to go first. And I believe that analogy actually works quite well with this situation. I am actually gonna offer Stephen David Simon, who was not next in line, but I'm so happy that he's here. I am going to offer you to unmute because Stephen is the head of the Department of Disability in the city of Los Angeles, and we're so happy that you're here. Go ahead, Stephen.
Thank you so much, Judy, and so glad we're having this conversation. I have a couple points I want to lay out, and I'll try and be brief on it because we are wholly in support of everything I'm hearing said today. We need to get the word out. This is a very political decision. So a couple things. I'm speaking mostly from an LA city and county perspective, but I think it applies statewide generally. First, I don't want us to forget folks who are in congregate living facilities. It does matter because they should have access right now already under tier 1. We're supposed to be getting everyone vaccinated in those spaces, and it's not happening. So that is the first place where people with disabilities are already eligible, but they're not getting tested, they're not getting vaccinated the same way that people in skilled nursing facilities are. And that's really not okay. And the state and counties are talking about moving to congregate living for seniors before even doing the people with disabilities in congregate living who are supposed to be getting served already. Number 2, when we get to everybody else, right, either independently living or living with family. Again, the definition is having an underlying health condition or disability that's already in the rules. And my department is going on record saying that we need to be eligible immediately in a new age-based tier structure. No delay, no tiering even of that group, but it is broad disability space and underlying health condition. We're also asking to ensure that caregivers and people in the same housing unit do get vaccinated at the same time. I know, Judy, you're pointing out we're talking about people with disabilities, not necessarily broader. However, just for a risk standpoint and an efficiency standpoint, let's do 5 people in the same home space if we can get to them. We need to ensure that the website and the other registration programs are accessible and navigable, and there has to be phone-in alternative for assistance. Again, it doesn't exist in a lot of counties, and we're very, very concerned about that. We want to develop the mobile vaccination routes and local community centers, not just the big pods that are set up like Dodger Stadium. We need home visitation models, and that should exist in all counties because, again, they're getting to the skilled nursing facilities. They should take those same efforts to folks at home for vaccination. So once we're eligible, we need to have notice that we're eligible, and people need to understand the mechanism to get tested. And that communication has to be set up, and it has to be developed and languaged and drafted by people with disabilities. And we need to be part of that in advocacy. And I look to you, Judy, for helping us make sure, and Andy in particular, to help us make sure that happens. Compiling the data, I heard data referenced on this call that I haven't seen yet. So can we compile all that in one place? I don't know who would be this with the library to put it together, but we need that data desperately so we can all access it and send it out. And then ultimately what we're offering is I'm trying to get my mayor's office in the city of Los Angeles to really be the largest scale advocate for everything we're asking for here. And I need help to do that. So I would expand on what Andy said, where you need to get to your state, the governor in particular, and your state officials. But please, I'm going to ask my my community affairs director, who's on this call, to put our email also and website in the chat. We need to hear, and your city council members and the mayor's office in LA need to hear from our community. Again, I'm not begrudging seniors getting the access; they need the access. But our legislators are not hearing from the disability community, and that will help me get the city on board to formally push our agenda here. So thank you for your time. Thank you so much for the work you're doing.
That was so great, Stephen. Could you put in the chat, and then I will capture the chat and get it out to really, we had 1,400 people registered for this, and not all of them came on, but we have a giant mailing list of people interested. I would love to get some of that information so people can get those letters in. That's fantastic. Thank you so much, Stephen. Next is Sean Costello. Are you still there, Sean? All right, I asked to unmute, so we're going to go on. Amanda Ariana. You have to unmute yourself. There you go.
Hi, everyone. Can you hear me?
Amanda. Oh, there you go, Sean. Amanda, hold real quick. Amanda, hold real quick. And Sean was first. I'm gonna have Sean go. Go ahead, Sean. Go ahead and unmute yourself, Sean. Oh, there you are. Go ahead, Sean. Excellent.
Can you hear me?
I sure can.
Okay. I'm one of the commissioners for the Dublin, California Human Services Commission, and we passed out all the money for all of the profits and not profits here in Dublin, and to the lady that had a problem with her brother that cannot take a mask. This is my answer to that. This is my COVID helmet. I use it. It's covering my whole entire head. That everything is covered. My mouth, my eyes, and everything is covered, so that you can see that there's other ideas for people like myself that cannot wear a mask. And also, you have to remember that me with a cerebral palsy and not being able to go to work since this all started. I don't know if the governor is gonna make us all get vaccinated just to go back to work or not. You know, that is my question. Is that are we all? Is it for sure that the vaccines that we're gonna take are actually gonna help us? Because me, I cannot even get a flu shot without getting sick.
Mm. Yeah, so Sean, that's an excellent question. As I said earlier, we are not at all medical professionals and can't answer that. However, we're going to have another webinar next week where we will have medical professionals who maybe can't answer your specific questions since they're not your doctor, but they can make some general statements. So please, you will all be on our mailing list and will get invited to next week's webinar. Thank you, Sean.
I would love to be one of your speakers, because.
Okay. All right, Sean. Put your email address in that.
I've been running for office for 32 years in Dublin for disabled people.
Wow, that's amazing. Thanks, Sean.
I just did my 16th election for the disabled people.
That's great.
One of the things that I have been trying to do is that, and I brought this up to my mayor at the time, and I go, we need to get a database of all the disabled people that we have in our area, so that we can check on all these people to see in all these dire situations if they're okay or not. And they keep telling me that I'm out of order.
Yeah, I agree with you completely. All right, I'm going to move on to their next, because we're already over time. I'm going to move on to our next speaker. Thank you so much, Sean. Moving on to Amanda. Go ahead, Amanda.
Hi, everyone. So my name is Amanda. I'm a person who has special needs. I have epilepsy, cerebral palsy, autism, ADHD. Yeah. And so, yeah, I also have asthma. And so a few reasons why the coronavirus vaccine is important for people who have like special needs is, first, people who have special needs often have like these health conditions that can increase their risk to get COVID, and if like they get COVID, they could have more serious effects. Second, so by these like conditions, I would say, for example, asthma, and also we people with special needs should get the vaccine because it will protect them more from the coronavirus, and and we should have more priority because we should because that will give a lesser chance for the coronavirus to infect other people, which will lower the infection rate, and also it will lower the chance it will lower the numbers of people who are infected.
Amanda, thank you. That was really amazing. And I like I like what you have on your face. Is that butterflies? Those are great.
Yeah, those are filters. So.
Oh, that's nice. That's cool. You'll have to teach me that sometime.
Thanks.
All right, moving on, Christina Canarella. So if I can ask everyone, we're running a little over time and we have a lot of people on the list. So please try to keep your question or comments to about 1 to 2 minutes if it's possible. Go ahead, Christina. Nice to see you.
Thanks, Judy. I appreciate it. Couple quick
You're
things.
Outdoors.
Yeah, I'm at work. That's why
Okay.
I got my 3 masks on and a shield. But here's a couple comments and a question. One is I understand getting households vaccinated, what Stephen had mentioned. However, what he had just mentioned prior to that, I think is more important, that there are people in congregate settings, there are people with disabilities who are medically fragile who have not gotten it yet. And I don't feel, in my personal opinion, that it's right for my 30-year-old healthy son to be prioritized to get a vaccine when there's somebody who could potentially die very easily if they get it. Also, we need to be collecting data on all the people with disabilities who are getting it. I asked regional centers when state council had this to try to do this, because there are a lot of people, a lot of parents and caregivers who are very concerned, and people with disabilities concerned about the impact of the vaccine for them. And we need to decrease the fears, and we need the data and the scientific evidence. So please, people on the state council, the work group about the vaccine, please find ways that we can start collecting data to get people to be open to the fact that the vaccine will be safe for them. And also we have to outweigh whether it's, my son was the one who Elizabeth talked about on a ventilator, intubated early January of last year, before COVID came out, from a weird virus. So it was COVID. And I saw firsthand in the ICU how fast somebody who's usually very healthy can get very sick with a disability. And I will share my story. But the last thing I wanted to say is, sorry, with the funding, I know there's the big push for the HCBS final rule for people to be out in the community, which is very important. But we may need to look at, if funding is an issue for access, we may need to look at reallocating funding from some of these, the $15 million for service providers. Maybe they can use that to get access to people with disabilities to get the vaccine or get testing, so they can be out in the community in the future. So that's just a couple suggestions, and thank you again for all of this.
That's great. Thank you so much. Nellie Palacios, you are next.
Yes, hello. My name is Nellie, and my brother has Down syndrome. He lives with us, and I am a vocal advocate for all disabled people to receive the vaccination. Upon my studies in my senior year at Cal Poly, studying business law and accounting, I understand that the nation's rollout for the vaccine is given to each state, and each state decides how it is allocated. And our Governor Newsom has decided to give the power to the different counties, which is not being very successful. So I stress to all of you to please write Governor Newsom, and if he can, do a statewide mandatory overriding the county's logistics. Because I took my brother to the vaccination site, they looked me in my eyes as I cried and they turned him down. And they said, do you know how many disabled people we turned down today in Santa Barbara County? And I said, God forgive you. God forgive you. So unless Governor Newsom takes the power out of the county's hands, we are just going around in circles. So I already emailed the state, I emailed the county, I emailed tri-counties, I emailed everybody, but it's on the governor's power to take back the power away from these counties, because the counties are not serving the constituents. So I don't know what to say, but God bless you all.
Oh, thank you. Thank you so much, Nellie. Thank you for being such an amazing advocate. We're going to go to Tori Cross.
Hi, thank you all so much. I just have a question. I know that during one of the presentations, we talked about advocacy for moving us from 1C to 1B, but my understanding based on the governor's announcement on Monday that we'll be like shifting to only doing age-based, my understanding is that like even 1C exists anymore. Is there anyone who can like speak more to that? Do we kind of know what's going on with that? I just want to make sure that like with our advocacy that we're asking for the right thing based on where things are at.
I'm looking to see if any of our main speakers are still on. I'm not actually seeing Aaron or Sylvia, or I know Andy had to get off. Russell, are you still on? Yes, you are. Russell, do you want to answer that question? Or I can also attempt to answer it as well. Yeah, there you are. Go ahead, Russell. Let's see. Oh,
Thank you for the question. And I apologize. I'm also going to have to leave after I answer this question. But this is a really good question. Thank you, Tori. I want to say two things. First of all, thank you for being willing to speak up and to follow this. I'll say the other thing is it's a shifting conversation. It is happening in real time. So what's true at the moment that I'm going to, say something may not be true by next week. And the reality is, yes, the state government is going to be reassessing the entire process, which is why it's so pivotal that right now our message be prioritize people with disabilities at the highest level possible. Don't put us behind other priority groups, or worse, leave us out entirely and not acknowledge our existence. We are not expendable, and we are people with high risk. So other states have successfully done this. So the call should be to do the right thing and establish appropriate priorities and then move from there. So I want to encourage everyone, the tier system may go away entirely. It may shift to something else. Who knows? At this point, I think the messaging is getting away from, everyone a little bit. So I'm hoping that at the very least, there will be a more focused effort on explaining how all of this is going to work. But if it doesn't come out immediately, we still need to push just as hard.
Thank you.
Definitely.
Yeah.
And
that's very helpful. Thank you.
And Andy Imparato is with us again. Sure. Thank you, Andy. Go ahead.
I'll be quick. I just wanted to chime in to what Russell said based on what we've heard on the advisory committee. Tori, what they've said to us repeatedly is that disability is part of equity, and they're going to work with us to figure out a way to move us up in the prioritization list. The reason we're trying to put pressure on the governor is they've been saying that to us for weeks, but they've actually been moving us down in the priority list. So it's a combination of us holding them to their word that we are part of equity, and getting the governor to understand that he's going to pay a political price if he doesn't address our concerns.
Thank you so much, Andy. Okay, so once again, we have a lot of people to get through. We may not get through you all because we have a hard stop at 6:30 because we will lose our interpreters at that point and we will not keep going without them. Eden and Linda, I'm not sure if it's Eden or Linda. Hi, Linda. Oops.
Hi, Eden. Eden wrote a message, so.
Thank you for this town hall. My name is Eden Rapp. I have Down syndrome. I work part-time at Mod Pizza. Because, because I have to wait down to I work at part-time at Mod Pizza. Because I have to wait to be vaccinated, and I am at risk, so my hours has been reduced to 4 hours on the weekends. I need the vaccine so that I can be more helpful and more accessible to my boss at work at Mod. So my question is, how can I help get more vaccines in California so more people like me can get vaccines so that they can be more helpful and accessible to their boss?
Andy or anyone? That was amazing. Eden, by the way, is on Disability Voices United Board of Directors and an incredible self-advocate. So I don't know if Andy is able to stay on.
Andy has left, Judy.
Oh, okay. Russell, I'm making you do it because you're one of our, I don't know if Amy.
I'm afraid Russell has also left, Judy.
Oh my goodness. Amy Wesling, you are our last one. Thank you, Amy.
Of course. So the question, I think, from Eden was how you can help advocate and make sure, again, not just for yourself, but how to make sure that other people with disabilities also have the opportunity to get the vaccine. Is that your question, Eden? Okay, so the number one thing you can do is contact the governor's office. So do you have access to the internet?
Oh yeah.
Yeah, all right. So the form that is available on the governor's website, and I know Judy and her team will be sending a link to it. I would like to see you take that exact message that you just read and paste that in there and send it directly to the governor because it's perfect. It says, I am a person with a disability and it's important for me to get the vaccine, but it's also important for other people with disabilities to get the vaccine. That's exactly what we need the governor to hear, and hearing it directly from you is the best thing we can ask for.
Thank you. Amy, can I ask a favor? I've just seen some people ask some questions about what other states are doing. And I don't know if you, I'm going to look for this. There's just been, this is great study on this that has been done. And I will try to get that link into the chat, Heather Flores. So, but could you also put the letter that ARCA put out, which has some of the research on how people with disabilities have higher rates of infection and death?
Absolutely.
Okay, I'd appreciate it. All right, and Heather, I promise I'll get you this report that shows what all the states are doing about people. It's mostly with IDD. All right, next. I think it's pronounced Mihai Freeman, or I'm saying it wrong. Please, I'm so sorry to maybe say it wrong. Go ahead and unmute yourself.
Can anyone hear me?
I sure can.
Yeah, sorry, it took me a while to negotiate the unmute button with my mouse stick. I want to thank all the disability activists and organizations who are here tonight at this town hall. But I really have to say, this has been a really, I know it has been everyone involved. But since the pandemic first started and there was a shutdown, disability organizations shut down, were able to have work from home and provide for themselves. For people, disabled people who didn't have that luxury, who were left high and dry. I'm talking largely for Black and brown communities. Now, I'm on this ventilator, have a done at homeschool, I work from home. I had very dense last year, January. I think it might have been COVID, but there was no tests. Since then, I've had to advocate for myself, to oxygen in my home, and really work hard to take care of myself because I'm very high risk in terms of my respiratory condition. And my doctor is very much an ally for me. But not many people have doctor support. So I know that the vaccine is very important, and the promise is that it will lessen the severity of disease, but that's not sure for our community because we have a lot of underlying conditions. We have a lot of medications that even if we do get the virus, we may have adverse reactions. So the onus should be, and I know it's hard and there's a lot you have to get to, but if this organization, if we as a group, as a people, do not unite around equity, inequality, it will not be guaranteed for any of us. We have people on the street who are disabled and who are homeless. Are they able to go on to the libraries to put down that they would like a vaccine and get in that tier? What about communities of color and seniors who don't have access to computers and get on databases? How are organizations going to have for them and leverage the power that you have to reach them? So I've decided, and I have it in my home, oxygen my doctor knows, I'm not going to be taking this vaccine. I'm not rushing to take it. I'm going to wait. It's my prescription. But my mom's a senior. I'm working hard to get her tested. I'm working for the right of other people to have choices. But it can't be, you can't be this fire alarm that's going on with this crisis, and there's no systemic platform to engage our communities, treat them and employ them so they're in these communities that have no outreach, that are marginalized, that are hardest hit. We have to stop this. No, we have to stop inequality in our community, based largely on race, inequality that has been long before the pandemic. So I'm just really intrigued that we're coming here, we're going to do this. But there's so much more to be done, and we come out on the other side. This is not the pandemic. We have variants. No one's talking about it. Okay? My doctor told me point blank, don't rely on this because there's no guarantee it might not be transmissible, which is not, it's going to be transmissible. So we have to support our family members who are taking care of disabled people. We have to have backups for IHSS workers. We have to have PPE. That's gloves, shields, masks, gowns, so that those who are not to get vaccinated, those who choose to not get vaccinated, those who cannot are still protected. It's not just about the vaccine that we have. Show our power, not from that of that. We are powerful people, we are resilient people, and we have to start speaking from that ethic. And any elected official that denies us, that renders us speechless, that silences us, we should tell them we're going to elect people that will, full stop. If we act out of weakness, that's how we are perceived, and we will die that way.
Thank you.
So please, like people who are on this group, I have Black and brown disabled people matter, we engage in organizations, but we have to start showing up and articulating our values and protecting our providers that help us be independent. I'm not weak. Thank you.
Thank you. I was incredible. And unfortunately, there's a few times where you froze and came in and out. So we're going to make sure that we go back and communicate with you directly to make sure that we have all of your message to the community. So thank you so much. So everybody, we are 3 minutes away from losing our interpreters, and so we have a hard stop in 3 minutes. So I'm gonna, if you could just keep your comments to a minute, that will help us. So Sheila, you are next. Sheila, are you still there? Okay, we're going to move on to Jordan.
Hold on, I'm here.
Go ahead.
I was finishing getting out of the chat, and every time I would start to get out of the chat, the Zoom would throw another chat at me, and I couldn't.
Okay, go ahead, Sheila. Go ahead, real quick.
So I think that one of the things that Sean was trying to say earlier came down to some folks with disabilities get sick if they go out in the community much at all, and they often will get sick if they get a vaccine. And so he wasn't speaking of it specifically just for himself, but we need plans and we need suggestions and recommendations about maybe how to have those conversations with the doctor, but also, I don't know what's happening over there. Conversations with the doctor, but also we need this to be recognized. The other thing, the reason that I originally raised my hand was we need programmatic access all the way along. Websites, local, need to be accessible, and yes, I've talked to my locals about it. Mine isn't. Some counties we want to take the decisions away from, but some counties are working hard and we don't want to take away from them. But also, we need to make sure that things like electronic verifications and notifications happen. Print does not work for me. I'm totally blind and I have multiple disabilities and underlying things, medical issues. So we need to fix that. We need to make sure that that is a thing. And yes, I will be writing some letters.
Thank you, Sheila. And you bring up the point that just the accessibility. So even if they put people with disabilities on the list higher up, there are just so many nuances that are part of it. I so appreciate you, Sheila.
I don't start video because I'm totally blind and I'm leveling the playing field. So.
I love it. That's perfect. I know that there are so many people who still have their hand up. And so if you have a question that perhaps one of our speakers could answer, I encourage you to email us at info@dvunited.org. If it's not a question that I can answer, which is highly possible, I'm going to refer your question to any one of our speakers today. I apologize, but we will not have our meetings without it being interpreted simultaneously, and they are needing to get off at 6:30. So I really want to thank Tim Jin, Elizabeth Espinosa, Aaron Carruthers, Sylvia Yee, Andy Imperato, Russell Rawlings, and Amy Wesling for presenting today. You were all incredible. I want to thank Ed Herzl from our staff who coordinated all of the logistics of this, as well as our great Spanish interpreters, ASL interpreters, and our closed captioning folks. So thank you to everybody. Wow, what an amazing, we still have 279 people on 2 hours later. We so appreciate you. We promise we'll be emailing you. A recording of this will be on our YouTube channel and on our website within the next day or two. Give us a few minutes to recover. And thank you all. Have a wonderful, please stay safe out there. Take care, everyone. Bye-bye.